And so this is your wonderful opportunity to ask anything. You know, bring up anything that you want to bring up. Doesn't matter what the topic is. Cancer and or other diseases are always multifactorial, which means lots of different causes. You know, there's just not a slam dunk approach to any illness, whether it's Alzheimer's, cancer, heart disease. They have us thinking that, you know, you just pump a pill and everything's great and wonderful. That is not the case with anything. That would be like you just, I always use the analogy, if I told you to start learning Japanese today, well, first of all, you go, what the heck? And then I'd ask you how you're doing in 3 months, and then you'd really kill me because, you know, you wouldn't have really accomplished anything. I know I probably wouldn't, but I'm just saying. And then in a year, how good would you be? So learning how to master your body is a process. It's not like you just come to me once and everything is just hunky-dory, or you come to one of the other doctors or a health coach or Liliana who does nutrition and emotion, where it's a process. It's not an event. Health is a process. And then we slip a little bit, you know, sometimes we don't eat as well, sometimes we don't detox as well, sometimes we don't exercise as much, you know, so we're kind of refining the process. And so we just have to then move forward on mastering ourselves. And that's what our goal is, self-mastery. And, but let me tell you, it's an ongoing thing. It's not like I tell people, when you don't need to learn anymore, then you're ready for the epitaph. And so I don't think anyone here is ready for that. So, anybody have any questions or concerns that are on the top of their head right now? Yes.
Oh, you go ahead. I'll go. Okay. I have a stage 4 colon cancer metastasized to my liver. I was NED for 8 months, and now it's coming back. And I'm scared. I'm a widow with 2 children, and want to look for other alternatives. Different opinions. How do I get different opinions, or any kind of hope enhancement, or
right,
something like that?
So for our listeners out there, and I don't think everyone heard you here. So how old are you?
I'm 49.
49. And so when were you first diagnosed?
A year ago, December 29, 2016. I woke up from colonoscopy and they told me that I have cancer. So from January 2017 until August, I was done with chemo.
So they first did chemo. So she was.
Well, actually,
how big was the original lesion?
It was 2.4 centimeter, and then they took out 7 inches of colon.
So they took out 7 inches of colon, and then they said they took out lymph glands, correct?
Lymph glands, yeah.
And then how many lymph glands did they take out?
7 out of 21 was inside.
7 out of 21 had metastasis, right?
Yes.
Okay. So then usually what she's talking about with any mass, what they do, whether it's in the breast or in the colon, they look and biopsy the lymph glands that could possibly be carrying the cancer. And so they do that to decide what the next treatment. So if there's cancer in the lymph nodes, they will routinely recommend chemotherapy, okay? Not always, but routinely. And so in her case, there was 7 out of the 21 lymph nodes positive. So then she had chemo, okay? How many months of chemo did you have?
6 months, 9 rounds.
6 months and 9 rounds of chemo. So during that time of the surgery and the chemo, what were you instructed to do to take care of yourself?
Rest, get help, and eat whatever I want to eat, because
they said you could eat whatever you want to eat?
Yes.
Okay.
Eat whatever I want to eat, but I don't truly listen to that recommendation. Just a lot of rest, get all the help that I can get, and
So they did not give her any direction, life direction on what to do to take care of herself. So if you're going to have surgery in my clinic, if I have a patient having surgery, I prepare them with the proper eating, the proper nutrition, IV vitamin C, hyperbaric oxygen before they even have surgery, even if they get cosmetic surgery. So we do that, and then we tell our patients what the supplements to take. So any surgical patient needs immune enhancement, any surgical patient, whether it's elective cosmetic surgery or surgery for cancer, okay? Because surgery is a very immunocompromising, injurious procedure, not only emotionally challenging also, right? And so you've got to prepare the body, one, for the surgery, but you also have to prepare the body because when the surgeon opens anyone up, whatever surgery it is, it doesn't matter, the cancer has the potential to spread because of the immune compromise, because of the injurious process, because of the inflammatory process. So that's very, very important. So that's the things we do differently here and we would have done, but now that time has passed for you. But for people, like anyone listening, all of us have friends, all of us family, our job is to parlay and give information to people. So I did not learn this right off the bat. I've learned it as I've learned going along my process, seeing patients and going to conferences and everything. And now, I hope to teach people, more and more patients and doctors, how do we take care of patients. So you didn't have that, and then you had the surgery and they said you're completely fine?
No. After I had my surgery, it actually doubled the size because of the stress of the surgery and everything. So by the time I started chemo, it was 2 weeks after surgery, and it was twice the size. And then
what was twice the size?
The lesion, the biggest lesion. It went from 2.4
to 5
to 4.6.
Okay.
So it's almost twice the size.
After 9 months.
After the surgery. The first CAT scan and then surgery, they were like 1 or 2 weeks apart, and then recovering from surgery 2 weeks, and then chemo. By the time the chemo started, it increased from 2.4 to 4.6, and then 6 months of chemo, it disappeared.
So after 6 months of chemo, everything was gone.
Almost gone.
Okay.
I was net for 8 months. Now it came back.
Right, so you know why it came back, right? So what happens is, so once the process of cancer starts in your body, so from one cancer cell to a 2.5 centimeter tumor, that's about 12 years in process. 12 years. Mostly. Correct. So that's why prevention and early detection, because cancer is a national emergency now, not only in the United States, but all countries. All countries, they're in the same predicament. So it's a national emergency. I know you don't hear this on television, but I'm telling you right now, it is, okay? Because cancer is 1 in 2 people now. So once it was a millimeter in size, it starts releasing the circulating tumor cells and stem cells. 1 millimeter, that's a pencil line, right? Yeah. So if it's 2 millimeters, it already has the potential to metastasize. 2 millimeters. Yours was 25 millimeters, right? So it was critical after they shrunk everything. Then at the beginning, you should have started going after the circulating tumor cells. Why? Because that's what's responsible for 95% of metastasis, right? So you have to concurrently, when a patient has cancer, you have to check the matrix of the body. What is the matrix? The working matrix of your body is, can you walk in here? Can you talk? Can you take care of yourself? What does all your blood look like? What does every organ look like? What is the nutritional status of your body? So before we even start fixing you, we need to do all those things, right? So you don't start just doing surgery and chemo and radiation without taking care of this whole body process, right? So unfortunately, in a conventional realm, they kind of just start giving you stuff, okay? It's just, we're changing things, but that change is going to take about 10 or 15 years because the doctors have to go and learn. I didn't learn all this. I had to learn on my own. I had to learn, all my practitioners, they all learn on their own and read all the time because that's just what it requires. And the new knowledge is changing rapidly, very rapidly. So if you look at the literature, all the studies show that what you're eating and your nutritional status is the most critical thing for cancer prevention and treatment. So, but doctors don't, they always tell the patients you can just eat what you want to eat. Well, I've never read a book like that. If I picked up a sampling of 30 health books, would they just say, oh, you just can eat what you want to eat?
No.
I've never read it in my life. I've never read a book that just goes, oh, just drink milkshakes and hamburger helper and tuna casserole. Like, I've never seen that. So, and it's never happened. Or just McDonald's and just kind of Subway and, it's like whatever. I've never read a book. Has there any book printed like that? Never. So how is a doctor telling you this information?
Well, they actually said eat healthy,
eat healthy, what does that mean? Eating healthy to you and healthy to me may be radically two different things. I remember meeting a patient. I tell my patient, she goes, "I started, you're so thin. How do you maintain so thin?" She goes, "I'm a vegetarian." And she goes, and I can't lose a pound. I'm 40 pounds of weight. And I said, well, like, give me an idea of what you eat. Well, she goes, well, she was telling me, and I'm like, well, like, you're eating so much carbohydrates, which are sugar. Like, so tortillas and tortilla chips, where, I'm like, you can't just eat like that. That's vegetarian. Vegetarians actually, they say they're vegetarians. If you just ate vegetables, you'd be thin. But if you eat lots of grains and lots of tortillas and lots of tortilla chips, I mean, you can, how when you go to a Mexican restaurant, you can eat those chips in a nanosecond, but they'll eat you first. So it's real. Okay, we've all done it. Let's face it. Everybody's done it. I've done it. So we're not any different. We all, those chips and salsa, and the bowl is gone, and then another bowl comes in. So then you have no idea what record you have of what you ate, right? So it's true. So anyway, but and that's a lot of it's a lot of calories, and it's empty calories, unfortunately. So anyway, getting back to this. So it's critical that we got to make sure that the body is working. That's the first thing. Let's just hypothetically pretend you just came into here to be healthy, okay? I would tell you, okay, we're going to make sure your blood work is good, everything's perfect. Then we're going to make sure your nutritional status, and let's fix and optimize all that. So that's what it should have been done day one, period. Then they did the chemo. When you do surgery, there's a lot that happens to a patient doing surgery. Then you add the chemo. Well, the chemo is very, 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 very toxic and is only effective partially. We have cancer cells that are chemosensitive and chemo-resistant all at the same time. And so, like here, when we give our chemo, we give you things so you don't have chemo resistance. So in the conventional community, they don't give you things to prevent chemo resistance, okay? But there's never a chemo that is 100% slam dunk chemo killing to a cancer. There's not a surgery that is 100% curative. There's not a chemo that's 100%, not even, and there's not radiation. So in your case, they shrunk everything to small, correct? Not visible on a scan. Is that correct?
Right.
So they should have checked your circulating tumor cells. So the circulating tumor cells is the future of oncology, because we now know that circulating tumor cells are responsible for 95% of metastasis. Metastasis is the cancer traveling to other parts of the body. And so what works on the circulating tumor cells? Not surgery, not chemo, and chemo can make circulating tumor cells worse, and not radiation. So only natural substances work on the circulating tumor cells. So in the worldwide, all over the world, circulating tumor cells are measured. Now, right now, we are primarily using a lab in Greece. And why are we using the lab in Greece? Because the lab in Greece has the most proficient technology to check that. The labs I've used here in the United States for the last probably 8 years, 10 years maybe, I checked lots of people's blood and everybody came back zero. So I'm like, that's impossible because there's no way. Every person I checked had a history of cancer, so there's no way they could have all had circulating tumor cells of zero, correct? So maybe one, but not all of them. And so I do not use that lab. So now, where are you now?
I have last recent TC scan 2 weeks ago. The lesion is 0.8 centimeter.
Where?
In the liver.
In the liver?
I'm not sure if it's an old one, recurring the same spot, or a new one. I'm supposed to get an MRI tomorrow. The doctor is looking to see if it's clean spots or if it's multiple spots. If it's clean, he wanted to do ablation. If it's multiple, then I have to go to another round of chemo. But my insurance is pending. I'm not sure if I can get an MRI.
Yeah, so it's only an MRI. Is there anything anywhere else in any other parts of the body?
No, just in the liver.
Just in the liver, and it's seems like a small lesion. They're going to do an MRI to verify one spot or possibly if there's anything else going on, right?
Yeah, they already know multiple spots. They just want to see if they can do ablation.
Right. So they want to know if they can do ablation. So ablation is a particular procedure to basically annihilate those lesions on the liver, which comes with its own risk, right? So what are you doing now?
Waiting.
No, what are you doing to take care of yourself now?
Oh, I do, I juice and I try to eat organic food and healthy. I should get more exercise, so I'm working on that.
Right.
And I'm also taking cannabis oil.
That's good.
And I also take Chinese herbal supplement. I decoct it from, from 10 glasses of water to 1 cup, and I drink it.
Right. Okay. So are you a patient here?
No.
Oh, I see. So you came here to learn. Good.
Yes.
Well,
yes,
welcome.
Yes,
welcome.
I came from St. Jude in Fullerton.
Oh, great. Okay. How'd you hear about us?
A friend.
Okay, great. Well, this is good. This is good for you then to hear. So, okay. So now, you need to do a little bit more work. Okay.
Yes.
Do you see what I'm talking about
yes,
now?
Yes.
Okay. So now, because as you know, you've already had a lot of chemo.
Yes.
So the chemotherapy destroys the immune system as well as gastroenterological system, the endocrine system, all systems. So I'm not an advocate of chemo on top of chemo on top of chemo. I'm not a big advocate of that because remember I talked about chemo resistance. So what is your marker? What is your CEA marker? Is it elevated?
Undetectable.
Undetectable. So what we're talking about, she has colon cancer, so there's a marker for colon cancer called CEA. And just so for all of you and our listeners out to the world, CEA is a marker for actually a lot of cancers, not breast and not ovarian, but it can be for a lot of different cancers. But frequently, tumor markers are not elevated, so we can never use those as an indice if a patient is okay. Now, if they're high to begin with, and we see them going low with all of our treatment, then we go, oh, they're going to be helpful, right? But a lot of times, like today, I just had a patient on the phone with head and neck cancer, and his blood, he just came, his blood tests were perfect in May. Now, we're just talking June 11th today. And then I ordered a PET scan, and the cancer is head to toe, and his blood is perfect. I'm like, whoa, how is that possible? But that happens. And I told him that.
Same as my case. My blood has been clean, undetectable. Everything looks good for the past 9 months.
9 months. So brings up another point, is perfect blood test does not mean perfect patient. So a lot of patients, there are certain things like blood sugar. She has blood sugar problems. So we know that her blood sugar is getting better because she's radically obviously changed her eating, but also I can check. But when you get your blood test, because a lot of people go, oh, went to the doctor, got perfect blood tests, probably I'm okay. Well, no, that's not a good indication. So that's why we do a little bit more we do other kinds of testing here to really know. And now all these years, 31 years later, I feel like it's mandatory to prevent illness in patients. We really have to emphasize this new kind of testing. It's not new for us, but it's new for the average doctor, and that's bioenergetic medicine. So because it tells us things that blood tests can't. So anyway, in your case, like I said, let's pretend. We're going to all do a consult, because some of you guys are veterans. I know you guys are veterans here. And for my little staff in the back, so the first thing what I would do is make sure you're A-okay. Now, tell me about your stress.
Quite stressful, as I am a single mom.
Yes, how old are your children?
2 children, 2 teenagers.
Oh.
Just moved, and
yeah.
My boy had, he lost his dad, and then I had cancer, and he just went wacko.
And when did you lose your husband?
10 years ago.
Okay.
And my boy failed 6th grade, and I think he's on the verge of depression. So, doing all my might to keep everything in place, and I think the past few months has been quite stressful.
Yeah, that's very, very difficult. And he may be, with his dad dying, he suffers from abandonment. And not that it was his fault or anything by any means, but a child, their perception of that, he was 6 probably, right? When this happened, correct? 5 or 3? Okay. Mm-hmm. So 3-year-old, it's very, very, that first 6 years is very, very, very powerful. And they suffer from abandonment issues. And then you've had your own stress. So with that, and so the children, you guys are, also energetically related and energetically off each other, right? Yes. So that would be one of the first areas. Besides, unfortunately, when you have cancer, you need to do everything, because it's like that's just what you have to do. You've got to sleep well, you've got to eat well, you've got to drink well, you've got to move well, you've got to take all your vitamins. You got to detox, you got to clean, and unfortunately, it's overwhelming. It's overwhelming. The diagnosis is just literally overwhelming, and you kind of just go, wow, I don't even know where to start. So you just start with getting a good night's sleep. That's the most important thing. Second thing is really deciding how we're going to talk to ourselves. We can talk in doom and loss and death and doomsday, or we can say, okay, I'm devastated, but I am going to be an overcomer. I am going to be victorious. I am not going to become my label, and I'm not going to own my label. I always tell patients, never become the label you've been given. And every one of us have been given a label, every one of us, because that's the way medicine is. Every one of us with something. But I always look at labels, because I've had lots of labels in my life. And so I just said, no, it's not going to happen. I literally say that. And I just feel like, okay, it's one more thing I need to learn to, help somebody else. Because when you become good at taking care of yourself, you really become good at helping somebody else. That's true. That's the really honest truth. Like, you tell people what it's like to have a child, and they can't possibly conceive of it if they've never had a child. Okay, they just can't. They can't. And then once, one of our doctors just had a baby, and she was single for 41 years. And then I would always talk to her about like what it's like. And then she always like, yeah. But then when she had this baby, oh my gosh, it's like, I understand now. And the baby's only 6 weeks old now, mind you. She'll be, wanting to deliver that baby to somebody else very soon. But anyway, because they're really sweet for about a minute. Unfortunately, or fortunately, But anyway, I mean, it is good and fun. But, it comes with lots of sacrifice. And you know that. So stress for all of us. And there's not a soul in this room who has not had tremendous stress, okay? I could guarantee you we could write a book on every single person, all right? But life is all how we choose to respond to it. And we unfortunately all need to learn very early on that we've got to handle stress well. We got to learn how to do that. That's why now meditation is so big. Because our world is out of control in stress. The world's out of control. The United States is in crises. Our health status is in crisis. Everything's in crises. Our children are sick. I mean, literally, we're in a very, very, very critical times. So we all need to not only help ourselves, we have to help the whole. You know what I'm saying? All for one and one for all. And so because if you're healthier, I'm healthier. If I'm healthier, you're healthier, right? Because we're all interconnected to one another. You're going to be a way better mother if you're healthy for your children, correct? So you've had a lot of stress. And if you think about it, your husband died 10 years ago. So remember I said that cancer takes about 10 or 12 years. So this probably, the shock of your husband dying, right? Not only for you, but your children has been quite traumatic. And we don't know how to sometimes deal with those stresses and maybe didn't deal with the grief of that and the understanding of that. And so that's a huge thing. So that's something that we do here. We do the emotional component that is critical. And now, a year ago, they determined on PET imaging scans that a patient's, they can visualize the parts in the brain where we're stressed, and when the patient has resolution of the cancer, that has also been anatomically changed. So it's critical, it's actually absolutely critical that there's an emotional component addressed with every cancer patient. Well, not just cancer, but heart disease also, okay? Or any other disease, really, there's an emotional component to even having a cold. So, because if you're stressed, what do? You get sick and get a cold or whatever, right? So I believe that is also a very critical, very, very critical thing. So, if you were to come here, like what I would do is make sure, your blood is perfect, and it does sound like your blood's pretty good. You've already had your tumor markers. I'd make sure your nutrition looks like you're already doing a great job with juicing and eating well. The biggest thing you have to do is get off sugar. We already know that one of the biggest foods for cancer is sugar. That's what a PET scan is. A PET scan is the sugar uptake value of the cell. So we know that sugar is a big component of cancer. So that's why you just can't eat whatever you want to eat, because cancer is a fermentative process.
I have a question.
Yeah, sure.
Sugar is carb, so grains, bread, and rice, those are carb too. I had been limiting my carb intake through sugar and complex carb to like 45 grams per meal. Is that too much?
Mm-hmm.
That is too much.
That is too much. Right. So we embrace, not completely, and it really depends upon the cancer, but more of a ketogenic or what we call sometimes a modified ketogenic lifestyle, which is basically fat, coconut oil, avocados, that kind of thing, moderate protein, and then your carbohydrates are just vegetables. Now, if you go to, there's a YouTube, Brian Seyfried, Seyfried, he wrote Cancer, a Metabolic Disease. So there's a great YouTube on that and discussing how cancer, lives off sugar. So, and let's face it, diabetes, aging, cancer, I mentioned diabetes, are all related to, eating high sugar, okay? So now we know a lot of the scientific findings on a ketogenic eating program. Now, I will tell you that ketogenic was started over 50 years ago, believe it or not. It was the eating program for a diabetic. And so now that's kind of been reinvented now and studied way more with the microscope how cells are. So it is just a better way, it's a better metabolic way of eating to preserve the body and brain. It's also the eating program for dementia now too. So and there's different kinds, because sometimes there's keto vegetarian, there's this keto, that. So it's a good program. There's lots and lots of information online. And so you can, and Brian Seafood wrote the book, actually the textbook, but if you just go and watch some of the YouTubes. And then I would be doing right now, we all have to do healing affirmations every day, whether we're purely healthy or we're sick. We need to be doing self-talk. Thank you, universe, God, for invincible healing. Thank you, God, that every cell in my body is resonating with beautiful energy to take care of me. Thank you, God, for this amazing immune system, et cetera, et cetera, et cetera. So I have a list of healing affirmations I'm more than happy to share with you. There's lots of different affirmations, but you just start and it just will become part of your life. And then now you would need to do some other testing and decide what would be best. The cancer is not going to go away until you get that circulating tumor cell test. It's just not.
What's the name of it?
It's called Circulating Onco Count.
Oh.
Onco, ONCOCOUNT, Onco Count.
Does that give you how many live cells there
Yes,
are?
how many live cells per 7.5 milliliters? Exactly.
Per 7.5?
Half milliliters. Right.
Isn't that to RGCC?
Yeah, that's the RGCC test. So the name of the lab is RGCC. You can go online and read about the lab. So they've been around for about 12 or 13 years, or in about 14 countries. So they are the most, I guess, evolved, accurate lab that I've ever used and seen, and using labs, because I use them. Of course, it would be easier for me to use a lab in the United States, but the labs they're just not accurate. They will be probably within 5 years, but they're just not there yet. So there are labs in France, there's labs in Germany that are available. So,
Are they as good? Is the one in Germany as good?
Well, a lab in Greece is about 86.7% accuracy. The other labs, I don't know if they post their accuracy. And so the lab in Greece gives me much more information that I need about what natural things work, what if I am going to do chemo, if I'm going to do chemo, what chemo works, does radiation work? So it gives me lots of markers that I need to address, because I tell people cancer is 100 leaks in the ceiling and it's a rainstorm, tornado, and hurricane. And you got to seal off all the leaks. Then it's serious like that. So it's not something, it's extremely complicated. And the doctor has to know gastroenterology, endocrinology, immunology, because you're addressing so many facets to the body, and as many things as you can possibly think of, you're addressing. So it makes it very overwhelming to the patient, because there's so many things to think about. So, but I would say in 31 years, the most significant thing that I've learned is that your spiritual, emotional countenance is probably the most important, because if you are doubting your healing, if you are not sure, everything you do will become less effective. So it's really important that we all set our mind. And it doesn't matter, cancer. I had a gentleman today that's been on an addictive drug for 10 years. So I told him the first visit, we're not going to deal with that problem. We're going to fix you first so that you can properly come off the addictive drug of 10 years. So I saw him today. Second visit, he felt great. He says, oh my God, I have so much more energy. And I said, okay, now it's time for us to get off the drug. But he's been on it for 10 years. He had neck pain, back pain, and got addicted to opiates. Anyway, so I go, okay. So the next thing is decrease the medicine you're on. So we decreased it. He came in today, and he had successfully, he said he felt bad for about 4 days. And I said, okay, I'm going to make a promise. I'm going to prevent you feeling bad. So we're going to do a special IV for you starting Monday, just one day. You're going to go down on the lower dose, but I'm going to give you an IV so you won't feel so bad. And I said, you have to do this. I said, unfortunately, addiction is psychological and physiological. So I said, and his wife was there, and I said, you have to do this, but you have to set your mind that this is what we're going to do. I said, if you don't set your mind, then we're all gonna fail. So all of us, every day, I don't get out of bed before I set my mind about how great today's gonna be the best day ever. That's exactly what I say. And then I start saying all the affirmations. I have so many now I can barely get out of bed. So it's true story. So anyway, and then I live my day like that. I live my day all day like that because I was taught how to do this, and then, and I'm like, and then I saw it take me over, and I was like, oh my gosh, and so it became like me. So you can, but you have to, it's all about practicing, right? If you're going to be good at piano, you got to practice. You can't practice once a week and go good. You got to practice every day, right? We got to practice, like practice good eating. We have to practice, everything's about practicing, right? So anyway, but I would say the most important thing we can all do is set your mind, be thankful, try to think of all the things you're thankful for, and an affirmative thing. Do all of your requests with affirmation, right? You don't ask somebody, you say, you thank the universe, God, in advance, in an affirmative way. Not that it's gonna happen, no, because you need it to happen right now. You need radical healing right now.
Act as it.
Pardon me?
Act as it.
Act as it, exactly. So, and then your cells change. And if you want to question anything, look up Bruce Lipton. Bruce Lipton wrote the book, The Biology of Belief, and he wrote it a long time ago, but go on his YouTubes, you'll love him. He's wonderful. And he talks about how he put these cells in 3 different petri dishes, and they influenced 3 different ways, and they're all the same cells, and they came out all different based on thought. So you have to, we are controlling our cellular destiny every single second of every day. But we determine that. We're the architect of our own thoughts. So but that's something none of us learned. I didn't learn that in school. I didn't learn that from my mom, right? I've learned that through all the trials and learning and wanting to learn and being curious. So anyway, what's your next question? You've been on the floor, so that's good.
My next question is, how much does the program cost?
Well, it really depends. Everybody's so different. Some people need lots of things because their disease is this big, and then some people, it's this. If there's a great book called Radical Remission, and this is a lady who studied, I forget, the book was a fewer patients, but she's done now over 1,000 patients, and they're radical remission, and over 4 of the implementations were just making changes in your personal life. And these were people with end-stage disease. So finding purpose, changing their eating, cleaning up their body, nothing was a lot wasn't doctors. It was a lot the things they just personally changed themselves. So that means that we have a lot to do with our final solution of healing, our beginning and ending.
So your program your program works with my oncologist, or do they integrate? Or?
Well, they should integrate. Okay. So I always tell people, if you are seeing an oncologist, you should be working with an integrative practitioner who can take care of you. And now oncologists, I will tell you, are more and more interested in integrating. They just didn't go to school for that, so now they don't know that, right? So, and it's going to take, their learning curve is going to be very, very, very big, just like mine was. I, started a long time ago. So I was learning and learning. It's a very, very long process to learn everything. So the doctors may not know. It's like, for example, they tell all of our patients, don't take IV vitamin C and don't take supplements. Well, there's studies, and I use these in my slides and my PowerPoints to doctors. If patients did chemo alone, and if they added chemo and vitamin C, their survival rate was significantly better using IV vitamin C. So, and I can share any of these slides with you. So it's why it doesn't make sense that chemotherapy is destroying your body and you can't support it. Doesn't make sense, right?
Right.
Chemotherapy is destructive. So you got to do all of these other things so that you protect the body, correct? So I don't know exactly what, we do all different modalities here. What I would do is just come in and get a consult and explore the possibility. So because, everybody's different. There's not just exactly one size fits all. I know eating and emotion is like where you want to start, and making sure you have all the nutritional requirements, which HMOs cover, Medicare covers, insurance covers. It covers all of that. So it's and then but I would start with this first, and you could start doing it yourself. If you just YouTube affirmations, you'll find a whole bunch of things.
I do that.
Thich Nhat. Last night I was looking at Thich Nhat Hanh affirmations, and I was like, whoa! I found so much just like one thing, because I was remember years ago listening to a cassette tape. It was probably 20 years ago, and he had to turn negative seeds into positive seeds, and so I was trying to find that, and then I found a whole series of how to turn negative affirmations into positive. So he's a Vietnamese Buddhist that's been around he's like 94 years old, 95. He's wonderful. So yeah, he's great. You'll love him. Anyway, yes, ma'am.
Okay, so when I took the RGCC, I learned that my body doesn't respond to things like matcha and dandelion tea as an anti-cancer food or
agent.
Agent. So then I thought, okay, why do I want to eat all these things that possibly my body doesn't actually respond to as anti-cancer? Is there a test just for like food and herbs and things like that I can take just to tell me which is going to be the best for anti-cancer for my body?
Yeah, that's a great question. So far, do you mind me repeating that?
Okay.
Yeah. So it would be. It's so funny. I always get these emails like, "Oh, kill cancer in 10 minutes," right? And I'm like, "Oh my goodness, this is such a misleading piece of paper." Anyway, and so yes, there's lots of different things that kill cancer. Garlic, for example, if you think about the top 3 vegetables: onions, leeks, and garlic. I mean, those are the top 3. My dream is to make a puree of that and make it taste good, and then you just eat that every day. So I'm serious though. Anyway, there is no test. We do know. I do have like the figures on I have the cancer killing effects of all different foods and everything. But what it works on you, like you were saying,
right.
And RGCC doesn't have that capacity to check everything. You can. I know they check 49 natural substances. And like if you requested dandelion and you requested a few other things, that's great. But there's no test. We know, like, for example, one of the most powerful cancer killing is vitamin D. All right? Vitamin D is influences over 2,000 genes in your body. It's like probably one of the most important supplements you'll ever take. So, but they don't. Pardon me?
How much can you take of that?
Well,
really?
I personally take 10,000 units Monday through Friday, but somewhere between 5 and 10,000. I would start at 5,000 I use. So to answer your question, there's no really panoramic view now of like the particular cells. I mean, that's the future probably, but it's just not available right now.
So I guess then what I should be doing is just rotating all the different anti-cancer foods
Yes.
just to hope I hit
Yes,
on the
because
right ones.
I tell people it's chess every day with cancer, right? And so that's what it is, because cancer is trying to outsmart every single thing you're doing. It's a very, very smart cell, and it's trying to outsmart everything you're doing. So the most important thing is to, rotate. Don't ever confuse the cell all the time.
Okay.
Yes. Bye-bye. You okay?
How accurate,
Nice meeting you. Yes.
how accurate are the CT scans then?
Okay, that's a great question. So she asked, how accurate is CT scan? So just so you know, for clarification, CT scans, first of all, they're radiation, so they're way more powerful than a chest X-ray. So radiation is cancer-causing and damaging to the body, so it's carcinogenic. So you should be taking protection if you get a CT scan. If you get a PET scan or a CT scan, you should be taking protection for radiation toxicity. That's number one.
What?
So usually what I give my patients is active hydrogen, water. You put a tablet, active hydrogen pill, and it neutralizes the radiation with something called SOD, superoxide dismutase. So superoxide dismutase is an enzyme that helps clean up the garbage in your body. So it's made from embryonic wheat sprouts. So anyway, I have people do like 12 of those a day because the radiation's powerful. So what is the visibility of cancer on a CT scan? It won't detect anything. A PET is nothing less than 5 millimeters. So on a CT, what do you think, Dr. Virginia? Probably a couple of millimeters, but
Maybe about the same.
it's 45, a little bit finer resolution, but not much. So you're missing now all the tiny lesions then. And then you're missing all the microscopic lesions.
Well, then how do you get that?
Yeah, so that's why we do the circulating tumor cells, and that's why we do biofield testing. So biofield testing is you have acupuncture points on your fingers and toes that correspond to every organ in your body, and it tells us the energy of the body. So what's influencing the body? So for example, if this point is the heart, and this one is the spleen, and this one is your intestines. So that's what it does. It's like a wire to the body. So just like when you get an EKG, it's checking the electrical rhythm of your heart. It's electrical assessment of your heart. An EEG on your head is the same thing. It's an electrical assessment. So now the new field of medicine, it's not new, but it's new with the new medicine, the bioelectromagnetic medicine. Now, it's not new because Dr. Reinhold Voll, V-O-L-L, invented it in, 1940. And he taught the original courses. I had an acupuncturist who worked with me years ago, like 30 years ago, who worked with Dr. Voll and learned. And the book volumes were like this big. And it was the most amazing thing. Well, in 1980s, that was all computerized. And so now we use a machine called the Biomeridian. There's another machine called EDS. If you see anybody who does electrodermal screening, there's experts all over the world who do electrodermal screening. So it picks up the energy and then it detects all the imbalances. And it's amazing. I personally have been doing it on my patients for 20 years, so it's not anything new for me. I learned about it from a cancer survivor that I met at a medical conference, and so he had a fatal cancer called osteosarcoma, and he took me under his wing and taught me everything he knew because he was diagnosed when he was 22 years of age, and they told him to amputate his leg, and he said, no, I don't want to amputate my leg. So he signed out from the hospital, and he spent the next 11 years, not months, years, figuring out how to save his leg and cure himself of cancer. So I meet him at a medical conference, and we commiserated on our past history of medical problems, and we became friends, and he became a mentor of mine, and that's how I learned about it. And so then I started doing it, and I went, whoa, this is like the most fascinating revelation of the body. So now it's you being used, you know, but it's going to take a while before things are, you know, become the norm, as you know. So.
Is that Molly's test?
Yes. Yes.
Dr. Connealy, we have a live
Yeah.
question.
Yeah,
When
sure.
you talk about MRIs, what type of scans we're asking?
Okay, scans. So there's lots of different kinds of scans. So there's PET scans, which is radiation. Then there's CT scans. Then there's MRIs, magnetic resonance imaging. So there's no toxicity when you get a magnetic resonance imaging, and you can detect smaller and smaller lesions. So a lot of times, all of our doctors recommend MRIs because there is no radiation damage, and there is a slightly better resolution and measurement of lesions. So that is a great question.
You mean, so, wait a second, I'm supposed to have a CT scan for my oncologist every 3 months, and I'm not wild about the oncologist. So my question is, because I'm looking for alternative ways, that I could have an MRI
Right.
instead?
Okay, so first of all, let's talk about what your condition is. So can you share with us?
Yes.
Okay.
I had pancreatic cancer. I was clean from surgery. I had
Beautiful.
No.
You had a Whipple?
I had a Whipple.
Okay.
I'm still struggling.
So patient had, can you hold on 2 seconds? Because for people, everybody. So she had pancreatic cancer. How big was it?
I think 2.2.
2.2 centimeters?
I'm not sure. I got a
Okay. It was 2.2 centimeters, so she had a Whipple procedure. Okay.
I pray it was 2.2 m.
Okay. Right.
I'm clean. All my
Beautiful.
23 lymph nodes clean.
Wow. Beautiful.
And at the end, the results supposedly were like 2.1 that I had. Therefore, they were trying to shove chemo. I was down to 88 pounds. I said no. So I've gained weight.
Good.
I'm trying to eat. I always did eat well, but not well enough, so to speak.
Correct.
So I would love to know what to do, because I would rather have MRI,
Well, I would do an MRI on you.
not the CT.
Right. I would do an MRI, and ultrasound is beautiful also, and there's no radiation. So I would do an MRI. They want to do MRI of your pancreas, correct?
Well, you know how much they remove on a Whipple.
Yes. So I would
All my guts. So
personally, an MRI is a beautiful picture of your pancreas.
what's left
So-
of it?
Right.
Will
So-
that also show the liver and everything else from an MRI?
It will show the liver. Mm-hmm. Mm-hmm.
And from an MRI, it would show if there's any other lesions anywhere?
Well, no, unfortunately, an MRI, you have to the doctor needs to put the order in for different body parts. So you can do an MRI of your abdomen and pelvis. Now, that you can't, the best way to look at the chest, unfortunately, is with a CT. Unfortunately. So what they're looking for, how long ago was this?
November 8th is when the surgery was.
Okay.
I had no symptoms, and within 3 weeks I had a Whipple after finding out about the lesion.
Mm-hmm. Well, you've done beautifully. You've done beautiful. So, so she had diagnosed in November. She's now awaiting scans. She's trying to decide MRI or CT. Personally, I would do. You have a lot more work to do. You know, you need to do the bioenergetic testing, because the scan is not going to tell us. The scan's not going to tell us little things. It's going to tell us big things. I always tell people the devil's in the details. So always is. It's not the lump or bump. That's the top of the iceberg. The bottom of the iceberg is huge, right? Right? So as I told you, a 10 or 12 year process can't be unraveled with some surgery and chemo and radiation. It just nothing is that simple.
So what do you
So
recommend?
obviously your extensive blood test, nutrition, it sounds like you've done, your own nutritional changes, correct? And juicing, are you doing pancreatic enzymes?
Yeah.
A ton, right? Pancreatic enzymes, and you need, you need, a very a good workup to make sure, because pancreatic cancer is in its own category, as you know. So that means you can't. I always tell people with cancer, get in front, get in front, get in front
They're in front of what?
of the illness. Do not wait. You can't wait. You know, that's the problem, is prevention is the cure. We're not preventing cancer, right? We're not practicing. We know how to prevent, and we know how to do early detection, and we're not doing it.
Okay, so I would, in this case,
But we can do it.
right, you want me, if you're suggesting an MRI,
An MRI, at least of your abdomen and pelvis right now. You may need a CT of your chest. You need to complete blood work. You need all your nutritional status with the NutriVal. You know, we do a complete panel of all your blood tests, checking all your nutrients, all your toxins, all your heavy metal, all your antioxidants, all that. And then you need to do the bioenergetic testing. You need to do it all.
that's expensive, isn't it?
No, because how old are you? Medicare pays for all the blood work. The bioenergetic testing is only $250.
Oh, really?
Yeah.
And so I could have the oncologist give me a prescription? for
No, no. Unless he knows about it and knows to refer the patient to a practitioner that does that, right?
this? Well, what if I go to my primary to do it, because I'm on a scan and you're not covered?
Yeah, well,
trying to
with
figure out how to get this all done.
bioenergetic testing, you have to work with professionals who know how to do that, right? Like, I'm not a heart surgeon, so you wouldn't come to me for heart surgery. So you have to go to people who are very, very schooled in that. So, yes,
So,
yeah.
well,
So,
I don't know where to go or what to do.
yeah. Are you local?
Yes.
Right. So, what you should probably do is become a patient here, and then the practitioner will refer you to see Molly. Molly does our bioenergetic testing.
And but the other blood work I could get through my own
Yes.
insurance.
Correct. Correct.
Okay. So I
Even
ha- I have the
HMOs pays for the nutritional
I
part.
have the blood work every month.
Right. But you need to enhance your care with all these other things that need to be looked at, and to look at the cancer not just from the top and the surface of scans. You got to look at why, where, when, and how did all this happen.
I can tell you emotionally.
Well, so there you go. At least you know that. That's beautiful that you know that.
Absolutely.
So
I'm getting
yes,
lots of questions in. So
yes.
let's finish the MRI. There's a question on detoxing before and after. What to take before and after for an MRI with contrast.
Okay, so with contrast. Okay,
Yes.
that's a great question. So the question is purification. I don't like the word detoxification. We're not going to use that. That's an ugly negative word. We're purifying like angels, right? That's how I look at it. So purification. So it's a great question. From a regular MRI, you don't have to do any kind of purification. But if you were to do an MRI with dyes, the biggest dye is gadolinium. It is very toxic and bad. So what you would do is the day before, you would do a bath of Epsom salts, baking soda, and clay. And drink lots of water the day before. The day of, you get your MRI, lots of water, and do a bath for the next, I would say the next couple of weeks, probably 3 times a week, because the bath will completely detoxify you from the gadolinium. And that is not only in adults and children also. So gadolinium, there was a big article in the Wall Street Journal about gadolinium toxicity. It is real, and it's not dose dependent. It is a real problem, so you definitely need, but that's what I usually use is the baths. It's just clay. Clay pulls it out of your skin. So that gadolinium gets in your kidneys and also here in the brain. So we have to detox with lots of baths. Sauna also works, infrared sauna also, but the baths I like, because everybody has a bathtub, mostly everybody has a bathtub at home that they can do. So I use 2 cups of Epsom salt, 1 cup of baking soda,
Wait.
and 1/4 cup of clay, magnetic clay.
What was it? How much of 1 cup of the
Baking soda.
1 cup baking soda?
Yes.
Can we have
Okay.
another question?
We have another question.
So they are asking, what do you think about hormone suppressants like Ibrance for stage 4 breast cancer?
Okay, so the question is, what do I think about Ibrance? Well, sometimes it's necessary. Let's say we have a patient that comes in with stage 4 cancer. We kind of have to do everything to see, okay? Because we're trying to get everything under control. So we might do low dose chemo. We might do some salicinium. We'll do mistletoe for the immune system. They may be working with their oncologist with Ibrance and maybe some bone protecting like Xgeva. So maybe in the beginning, I might use that because I tell people, let's just throw everything at it, okay? Because that's what we got to do to make sure what sticks. Because remember, it's 100 leaks. And we're trying to fix them all today, right now. So Ibrance affects sometimes a leak in a patient. So now on our testing, it tells like, does Ibrance work? Also, like our testing will tell if Ibrance work, what hormone blockers work. It tells us. So we have a guide. So, but now the oncologists are using it as a possibility in estrogen-driven cancer. So, but again, I have used it with patients to see, and then I monitor them for the next 3 months. How are they feeling? How is it affecting? What does their blood work look like? Then let's repeat the scans and see how much progress we've made. So sometimes you do that. That's why we work with oncologists. We work with them because two heads work better than one. Yes.
They're asking about a CT scan detox.
Okay, that's a great question. We talked about that early, but a CT scan, you should definitely start the day before with active hydrogen. We use, what's our active hydrogen? H2 plus, what is it? H2, Restore, yeah, Restore H2. I can't forget exactly the name.
I take it.
One of our patients. Anyway, so I have it in my counter, but I can't remember. Anyway, they're a little blue tab. But anyway, activated hydrogen is basically the antidote. It basically combines with any chemical and brings it out and liquefies it as water. So I have the patients do that with SOD. SOD stands for superoxide dismutase. So I have them take 4 pills of that 3 times a day. You start the day before the scan and you take it for the entire month afterwards. But it's critical. Every doctor should be using radiation detox. I mean, just like, it just makes sense, right? If you're going to take something chemical, we got to counteract it with something good, right? So just like if you drink alcohol. If you drink alcohol, let's say you enjoy a glass of wine or champagne or whatever sometime, you need to be taking milk thistle. So like, just like if you smoke, let's say you smoke, smoking's an addiction. It's sometimes very difficult. I used to work, my first job was working at a smoking clinic, addiction, clinic. Anyway, but if you have to smoke, then teach the patient how to detox. Give them a lung cleanse. I mean, this is just common sense, So, anyway.
So let patients know where we're at, and I let them know where they go to cancercenterforhealing.com to sign up, to become a new
So
patient.
if anyone wants to know, I'll introduce myself. I'm Dr. Leigh Erin Connealy. I work here with an amazing, fantastic team of other doctors and other team members that are literally, it's amazing. We are Disneyland for medicine, for everything, not just for cancer. We're talking about cancer, but we treat everything from cold to cancer, and we try to do things that support, help, teach, educate, to create a complete healing sanctuary in the body. So we have Center for New Medicine, and then our cancer center is called Cancer Center for Healing.